Welcome to the Medical Association of Georgia's award-winning Top Doc Show. With more than 8,000 members who care for patients in every specialty and practice setting, MAG is the leading voice for physicians in Georgia. Go to mag.org to join MAG if you're a physician in Georgia. And thanks to MAG Insurance Agency for its support as a sponsor.
Welcome to the Medical Association of Georgia's award-winning Top Doc Show. With more than 8,000 members who care for patients in every specialty and practice setting, MAG is the leading voice for physicians in Georgia. Go to mag.org to join if you're a physician in Georgia. I'm Jeremy Bonfini, the Executive Director and CEO of the Medical Association of Georgia. And today we want to talk about the healthcare workforce. Even before the COVID pandemic revealed the understaffing that we all were struggling with, it's been a challenge that has persisted. Today, I'm very pleased to introduce our audience to the Central Georgia Medical Care Network and the Central Georgia Technical College. Both organizations have decided to undertake an incredible journey to help bring up the next generation of the healthcare workforce. I'm joined by Nancy Farage, who's the Executive Director of Central Georgia Medical Care Network, and two leading physicians in CGMCN, Dr. Sandapan and Dr. Shah. I'm also joined by Alvin Harmon, Dr. Harvin, who's the Associate VP of Academic Affairs at Central Georgia Technical College. Nancy, let's start with you. Can you give us a little bit of a background on Central Georgia Medical Care Network and tell us how the initiative to develop a technical certification pilot program started in Central Georgia? What was the need that you identified?
Thank you so much. And thank you to MAG for inviting us. We appreciate this very much. So Central Georgia Medical Care Network represents over 200 physicians and allied health professionals in the Central Georgia area. And Dr. Shah is going to give you a little history about the network and some of our goals. But I will tell you that, like a lot of associations in local areas, we realized a few years ago that there was a very serious problem in resulting in a shortage of allied health to support our medical offices. And when I say medical offices, I'm including the hospitals as well. This severe shortage in qualified staff resulted in a problem of denial in many offices, which it was denying access to care. And so we sat down at one of our board meetings recently and talked about this problem and talked about how could we develop a pilot project here in Central Georgia that would be looking at cross-training individuals that could support our providers to address this shortage and access to care that has been compromised. And so we sat down with Central Georgia Technical College and put together a pilot, which we want to talk to you about tonight. And hopefully your listeners will find that of interest and maybe even want to replicate this in their markets as well.
Great. Thank you, Nancy. Nothing worthwhile is ever easy or inexpensive. Dr. Shah, can you tell us how funding for this very interesting pilot project was initiated?
I would like to give a little history of this organization. This is what we call an IPA, Independent Physician Organization or Association. This was started in 1970s. The individual physicians needed organization to have a contract with the insurance companies. And also what he did is he accredited all the physicians. So once you accredit with the IPA, IPA will send to all the insurance company or information. So you don't have to do it on each insurance company individually. And the organization worked very well. We had almost all the insurance companies contract. And things change when our organization was not large enough. So we had to go to some larger organization who can have a more power to negotiate. A lot of insurance company did not want to negotiate because we have only 150, 200 physicians, while they had 1,500 physicians. So slowly and slowly, all the physicians moved to those bigger organizations, and our purpose was going downhill. So, but one thing we did is an incentive program. So a lot of Medicaid and Medicare commercial plans, if you meet certain criteria, like mammogram, pap smear, diabetes control, high blood pressure control, if you meet those criteria, they give you good amount of money as an incentive. And we were one of the best organization in Georgia. We were very, very successful, and we got a lot of money from the insurance company. But finally, the time came that our organization was really not needed. So we closed our office. We had some funding, and we wanted to give it back to the community. We wanted to give back to the healthcare institution or education. And we decided to give 100,000 last year, another 100,000 this year. And on the other hand, the college also decided to put their own money, $235,000 each. So it worked very well.
Great. Well, excellent. Thank you so much for that history. And it's a very generous contribution to the community. And the fact that the college is matching only amplifies that impact. So it's a very interesting project, great impact. And there's an acute need here. Dr. Sandapan, what certificates were chosen as a pathway to bring up the workforce?
Yeah. Thank you, Mag, for inviting us to this very important issue in medicine. Really appreciate this topic. I think this is very much needed. First of all, I want to thank our board at the Central Georgia Medical Care Network who come up with the plan to implement to improve the workforce. As a practicing physician in Central Georgia, we have very difficult time to keep up with the employees who have skills because several physician offices can say that when we hire people who are not experienced, we actually give on-the-job training, and it takes time. And like Nancy said, the access is limited when they're training. We have to see less number of patients, as well as, we have to educate, and they leave in the middle because they don't like to train during the job. So there are a lot of difficulties, hurdles along the path. And thanks to Dr. Allen, who's the president of Central Georgia Technical College, and Dr. Harmon, they come up with a plan with our board. So we are actually, we wanted to get the basic training for office staff, mainly front office and back office. So as you can see, there are 5 different courses. One is accelerated phlebotomy technician, and the second one is nurse's aide, and third one is medical coding, and then medical assisting receptionist, and health and wellness coach. The phlebotomy technician can be used in doctors' offices as well as in the hospitals. They're always short supply, and this course is mainly geared towards students coming out of high school. I think Dr. Harmon will explain more on the process. And they actually can use our funding from both the Central Georgia Medical Care Network as well as the CGTC funding, and along with the HOPE and Pell grants if they qualify. Even Dr. Harmon will explain more. They can even offer some transportation. So it will be almost no cost to the students, which will be potential employees within 6 months. And more than that, we are also offering practicum in the doctor's offices directly when they're during the course. So they can get the jobs right away when they finish. And as you all know, these jobs are very much in demand. With the unemployment rate going up, this will be really, really great. And also for some of the students who don't want to work in the back office, the medical coding, and the front office receptionist work will really, so I mean, it'll be well suited for them. So this is overall a great program. I think hopefully I know it'll be very successful in Middle Georgia because we have so many doctors' offices. We have talked to several doctors' offices before we kind of start planning for the program. Everybody said we need phlebotomists, we need medical assistants, we need coding people. Of course, the hospital need nurses, but Central Georgia Technical College and other colleges are working on that too. But there is no program as like this that we know of in all of Georgia. I think Central Georgia Technical College will be a pioneering college, and we from Central Georgia Medical Care Network, we are proud to be part of it. And I think it'll be very successful. Hopefully, we'll give another talk in a year to tell you all how successful we are.
Great. Well, that's really comprehensive and appreciated. I love the fact that you're offering the practicum opportunity as well, because that allows the students to transition out of the classroom and into the real world. But speaking of the classroom, I want to recognize Dr. Harmon at Central Georgia Technical College. Dr. Harmon, who's eligible to be a student? What are their qualifications? And tell us a little bit about financial need and completion.
Okay, well, let me first say thank you to MAG for inviting us to appear on this podcast. And let me also say thank you very much to the Central Georgia Medical Care Network for considering Central Georgia Technical College for this opportunity. So the first part of your question, in terms of who is eligible, this program is organized in such a way that dual enrollment students, those who are in high school, could take some of the courses starting early so that when they graduate, they could move seamlessly into the clinical components of some of the programs. We're also focusing on employees. And I want to emphasize this aspect just a little bit. We know that with private practices, retention of your employees is critical, as well as having employees who can do a variety of different job duties. So if an individual is out for a small practice, let's say that an individual is ill or needs to go out of town, and they are the phlebotomist for that practice, well, that could slow up the ability of that practice to see patients for that day in terms of a follow-up to say, what did the labs show? What did we find in the labs that we need to share? And so our thought was, in lining with our mission, community and workforce development, let's cross-train employees who are already working in these practices so that it, one, enables those practices to, one, be sustainable, to continue to provide quality medical care for the patients that they'll see in the community. And then also, in small town Georgia, especially small town USA, sometimes we have difficulties finding enough employees to fulfill all of the job positions that are out there. So if I've got a medical receptionist who's also trained as a phlebotomist, as well as a CNA so they could function in a medical assistant role, that individual then could easily help a practice that may be getting behind for the day because someone is out, or they could also help them catch up with seeing patients. I want to share a little bit here is that my wife is a physician and she now works on the insurance side. And one of the things she talks about are peer-to-peer calls with the physicians. And so let's imagine that a physician has to engage in several peer-to-peer calls throughout the day. Well, that slows up patient care because they're not able to see as many patients because they're talking to the insurance side. So we also have a component where we want to train individuals to be medical billers and coders. It's critical that procedures are coded appropriately, so there's a more likelihood that they'll make it through the insurance on their first side so that the physicians can again provide care. So not only are dual enrollment students, those in high school, able to participate in this initiative, but also employees within physician offices, especially these private practices that at times may have difficulty not only retaining employees, but just finding employees. We think that this will enable individuals to maybe find what else they're interested in as they serve within a physician office. But it also contributes to the bottom line. We often may not like to talk about the cost of healthcare, but it is critical that private practices be able to charge what is needed, because we want them to be around 20, 30, 40 years from now. And so it is critical that you have individuals, I think, trained in a multitude of specialties so that they can help that practice. And hey, we can see more patients. It ensures the sustainability as well as the viability of a practice.
Great. Well, that's extremely comprehensive. You have a number of different approaches. I love the cross-training element because you already have workforce available that you can reach out to and train. That's really quite excellent. When do you think you'll enroll your first student?
We already have done so.
Okay.
So we've had two recruitment events at Houston Healthcare, one in One Robbins as well as at the Perry location. We've had over 25 students who've expressed an interest within the program, and we've communicated with them. But right now, we do not have the full 25 enrolled, but we have several students who are enrolled in different programs now. And we're also getting ready to start evaluating the scholarship that Central Georgia Medical Care Network is providing. And let me add a little bit in terms of the cost. All of these programs are eligible for the Hope Career Grant. And so the Hope Career Grant will cover tuition and fees as well as provide a stipend based on the number of hours. There are certain criteria, of course. An individual needs to be a Georgia resident for at least 2 years and be enrolled in one of the high demand industries as identified by the state. And all of these programs qualify. So the goal with these scholarships and how we can use these funds and positively impact more individuals, with us covering most of the tuition and fees through the Hope Career Grant, then the scholarship can pay for scrubs, it can pay for the background checks, it can cover the cost of books, it can help with gas cost for the individual. So what we're trying to do is show how these are seamless pathways to enhance the community's workforce at a favorable cost.
Great. Well, that's excellent. Nancy, what are the expected outcomes of the program?
Well, we're really looking at 3 specific outcomes. Of course, the primary objective is to provide this cross-training training program for allied health. But the first one is to recruit at least 50 allied healthcare workers to participate in the cross-training. So we've started this month, as Dr. Allen mentioned, and we're working on increasing that number, but recruit at least 50 to participate in cross-training. Our second is to develop a health and wellness coaching component for allied healthcare workers. And particularly here in Houston County, we have a large demographic of seniors that live in this area. A lot of people want to retire here. We've got Robbins Air Force Base, as you know, that's our partner here. So we have a lot of retired people, and chronic illness is a real issue for a lot of the physicians managing that. So being real aggressive with that is one of our definite objectives. And then our last objective is to establish a baseline, which Dr. Harmon is helping us with that. Our physicians, our board is meeting with the college on a quarterly basis. We're looking at enrollment. We're looking at the criteria for participation in the programs. We're looking at what the agendas are for the training. So actively being involved in that so that we can support project expansion. The other objective that we have, and we've already started working on this, Jeremy, is that we have went out to the community and we're talking about this program and asking them for their support, either financially and or committing us coming out and working with their employees. We've gone to the University of Georgia. They're looking at this as a pilot. They may want to add some components to, but possibly through the Department of Community Health and Department of Public Service, there may be some opportunities there. We've gone to the city of Warner Robins and the city of Perry, and they have offered their support and possibly some financial aid, because we're looking at workforce development here for the community. And they really like that. One of the things we talk about a lot is that, as many of us know, employees, a lot of people think employees stay in a job or leave a job because they can make a few more dollars. But statistics show that why people like to work at a particular place is they feel like they're engaged in it. They're part of the team. And so having the practicum where they work in the doctor's office, they see how, the other team members engage with them, that we feel is going to be critical. And workforce development is about retaining those graduates back into our system. We've also reached out to Robins Air Force Base. They have a program called the Rosie Project, and we're supporting families of military spouses and coordinating this with some of the programs they have, as well as different foundations in the community. So we've really reached out, even locally, to like Kiwanis Club and Rotary, to let them know about these programs. If we just get one referral, one person that says, you made a difference in my life. I never thought I could go to college. I don't have the means to do that, but this is an opportunity for me that I can really change my life as well as others. That's what we're looking for. So those are the outcomes that we're really striving for.
Great. That's a wonderful note, Nancy. I sincerely hope, and I know that this will be a very successful program, making a difference in the lives of individuals working to upskill and advance their careers. It really is an incredible thought and sentiment that I appreciate you sharing with us and our audience. This program does air nationally and, of course, across Georgia. Are there any final thoughts about the unique nature of the program and how it can be replicated nationally from any of those who've gathered with me today?
I want to state that what I really like on the academic side is this concept is not just only for healthcare. Perhaps there are other industries where we could look at cross-training to help retain employees, and it will still align quite well with our mission at Central Georgia Technical College. Now, healthcare, we know with COVID, it has increased our need to be flexible as well as to be innovative. And so I like that it's a pilot program because we're learning. As much as we are already implementing the curriculum, already working with the healthcare practitioners, we're also learning in terms of how to better reach employees in the community, how to improve upon providing this opportunity and making the public aware of it. To this collaborative effort. And I am really excited and enthused to see where we will go and where this will take us.
Great.
The other point, I just want to add one more point to this. I think most of the working people, when we talk to them, they also said the cross-training helps to improve their salaries and revenue-wise. And also, I think Dr. Harmon did offer weekend and evening courses at least for several people who are having full-time employment. So that'll make a big difference in their lives.
Great. Thank you, Dr. Sandapan. Dr. Shah, would you like to close us with any final words of wisdom?
I think this is one of the best programs I have seen, which has developed with the community, with the college, and working together. I think this will be one of the best projects in the Georgia and probably nationwide that we can all learn from it. Thank you.
Thank you, Dr. Shah. Your enthusiasm and the enthusiasm of everyone tonight is contagious. So thank you so much for participating in the interview today, and to our audience, thank you for watching this episode of Top Docs. Please share this program with your colleagues and family and friends. And remember to follow MAG on Facebook, Twitter, and Instagram. And don't forget that you can get past episodes of the show at mag.org/topdocs. From everyone at MAG, we look forward to catching up with you on our next episode of Top Docs.
Thanks for watching this episode of Top Docs. Please share this program with your colleagues and family and friends. Remember to follow MAG on Facebook and Twitter. And don't forget that you can get past episodes of the show at mag.org/TopDocs. From everybody at MAG, we look forward to catching up with you on our next episode of Top Docs.